Hello, everyone, and welcome to Chapter 4. Please pardon my obscene Xbox headset. The microphone on my computer doesn't pick up the audio very well, and I wanted to be clear in my narration. I'm going to try to keep this video succinct for you all since Chapter 3's recordings were quite long, but we're going to talk about clinical assessment, diagnosis, and treatment. You all are going to read the chapter, and so I'm just going to try to give a general overview of these topics. So what we're going to look at is clinical assessment, diagnosis, treatment, and kind of a pinch about the future for clinical assessment. So what we're looking for right now, when we're looking at, previously we talked about models of abnormality, right? How do people view psychological abnormalities? How do they treat them through their specific perspective? We're going to address that a little bit, but these topics are going to be kind of the general overhead. So while we have some models that differentiate where they see kind of the root of psychological abnormality, these are kind of standards. Think of them as the broader topics, and they can vary based on the model, and you'll see what I mean by that. But we're going to look at how and why does a client behave abnormally, right, on the whole, and then we may look at specific instances. We're going to also look at if the client's syndrome matches a known disorder and how might the client be helped. That's what we're looking at with treatment. So with clinical assessment, we are trying, on the whole, assessment is just collecting of relevant information to reach a conclusion. Now, in the case of abnormal psychology, this clinical assessment, we're trying to use this to determine whether, how, and why a person is behaving abnormally and how that person may be helped. So I do want you to make sure you read the, the case study in this chapter, because it gives you a general scenario for abnormal functioning, and it kind of gives you a little bit of practice into what goes into a clinical assessment, right? Clinical assessments are important for not only figuring out how we can help a person and change any thoughts or behaviors that may be maladaptive, but also tracking their progress throughout a therapeutic therapeutic procedure. And this is where we get into that idea I mentioned previously of the model and form of treatment may depend on a clinician's orientation. So if someone is a CBT therapist, focusing on the cognitive behavioral aspects of someone's life, they may be a little more systematic in their clinical assessment, and their treatment is going to focus on changing certain behaviors and thoughts surrounding those behaviors. Whereas if someone falls more in line with the biological perspective, that treatment may look at abnormal functioning as a result of biology, genetics, and some kind of abnormal physiological functioning that needs to be fixed via maybe a type of pharmacological intervention. So characteristics of assessment tools. So what are we going to use to assess people? Because we can't just see someone, they're crying all the time, they're depressed, right? We can't just make a guess, because we have general criteria that has to be established over time. We don't want to let bias influence a clinician's decision and diagnosis. So assessment tools, what we look for in ideal tools is what's called a standardization, reliability, and validity. When something is standardized, we are basically setting up steps to be followed when this test, this measure is administered. So for example, when we take standardized tests, that's kind of a hot topic in the education world. We do what's called norming. We have one group take the test, and we believe they are representative of the norm. So then the next time you take the test, you see how you compare to that average. That's the process of standardizing something. We want to make sure we follow the same steps and make it as systematic as possible. Reliability is important because it gives us a consistency of the measures. We have to know that if you take a depression inventory one time, like on a Sunday, and then we say, let's retest you on the next Sunday, you should get similar results with each of those retests. That's what we're looking for with reliability. With validity, we're looking at the accuracy of measures. So is something, measuring what we are seeking to measure? This is the idea behind a scale example. I'm going to use a weight scale as a representative of this concept. So a weight scale seeks to measure our weight, and we want to know if it's accurate. So if we get on the scale and it says our weight, like 140 or whatever you are, we believe with certain, without reasonable doubt that that's accurate, right? Because the scale has been tested over and over again. It also has reliability. If you step on the scale and it says 140, we're going to hope that that scale, if you step on it 2 minutes later, says around 140, because if it says 250 the next time, that's not a very reliable measure. Your scores should be somewhat similar, and it should be measuring what you are seeking to measure. One more point. If I measured head circumference as indicative of intelligence, that's not a valid measure of intelligence, right? It's reliable. I'm going to get the same results each time, but it's not accurate, right? That's not indicative of intelligence. And so we have different levels of validity, including face validity. Think of that as very shallow. It seems like, oh, okay, that makes sense in a measure. So if we're going to measure something for depression, and I create a random 5-question questionnaire survey, but I didn't standardize it or test it out before, we might say, yeah, that sounds about right. I mean, people are sad when they're depressed. They'll cry. They'll do this thing, right? We're kind of taking it at face value. We want to go deeper than that. And we want to look at predictive ability, or predictive validity, so the ability of the test to be a reasonable projection of how the abnormal functioning will progress in the future. So if someone's acting a certain way, we kind of want to examine the trends of that disorder that are common so we can help them and kind of be more proactive in our approaches. And then we have concurrent validity. So this is the idea that when you take things at the same time, right? Let's say we're making a new measure. We want to make sure that this new measure of depression is going to have reasonable outcomes with another measure that has been standardized and tested vigorously. So it's kind of like we want to make a new one, but we're going to compare it to something that has already worked. That's concurrent validity, so they're doing them at the same time. We're also looking at different assessment tools. So how does a therapist come in and assess different clients? Now, if you've ever been to a therapeutic session, you might see that they start with an interview. This is very good. It collects personal, detailed information about the person's feelings, relationships, and their history. But it is not very systematic, so it's not really reliable nor valid. And why do we say that? Because if we had 2 people conduct an interview on the same client, they may have different results. So that's not really good reliability. Moreover, with validity, we don't know that we're getting all of the information that we're trying to find, because sometimes clients may hide information for fear of embarrassment or shame, or sometimes there could be bias in the interviewer's skills without them knowing it, right? Or maybe they don't have a sensitivity to multicultural issues, so the client doesn't feel like opening up. These are all sorts of things that can affect the efficacy of a clinical interview. But it is good for gathering information. We want to make sure we're not focusing on the wrong information or mistaking certain information. My screen is not recording this whole section of the slide. Let me move that down. There we go. So we also have different types of clinical tests that I've listed here. I'm not going to go into them extensively, but just know that projective tests, this is a very popular technique among psychodynamic psychologists. The idea is that you project. Back in the day, if some of you remember, we had projectors. So they would show an image or a video on like a white screen, right? We still have projectors. They're just a little different. So the idea is that something in our personality or something in our abnormal functioning will be projected onto the task at hand. And so this is measured through Rorschach ink blot test, for example, which this would be an example of an ink blot. The therapist would ask the person what they see, and the person would kind of say, oh, it looks like this, or it looks like this. Then it's up to the therapist to kind of analyze what the person is saying. And then there's also thematic apperception tests. So you see these are kind of creepy images. But the therapist will give the client a type of image that's kind of vague and ask the client to tell a story about that image. And the idea is that there will be a theme within that story that the therapist can analyze. Those are different examples of projective tests. Again, not very reliable or valid once we've, systematically measured them in an evidence-based study, trying to gather evidence on its efficacy. But they are still used today, just not extensively. Very popular in the 60s. Then we have personality inventories. These are standardized. So when you take a personality inventory, you are trying to figure out characteristics of someone, behavior, emotions, things of that nature to paint a picture of their personality. So they're somewhat valid because they've been measured and standardized so many times. And they're pretty reliable because you tend to get consistent results. The only limitation is that sometimes when people are reporting their own information, they're not exactly accurate in telling you about themselves. People like to say, oh, I would do this in a certain situation, or I would act this way. But reality may be different than what they predict of their own behavior. And sometimes there may be a cultural bias in different testing. You'll find that's an issue that's consistently being assessed to improve the testing process. For example, thematic apperceptions test had issues with cultural bias because a lot of the images did use at the time white people. And there may be a question as to whether people of color would identify with those white people in the images. Would they be able to truly project their feelings onto an image they can't relate to? Then there's psychophysiological tests, which just is going to look at physiological responses in response to a psychological task. So like a polygraph or a lie detector test, right? That measures your heart rate and different factors related to lying or those stressful situations, because we believe that lying and anxiety is indicative of those physiological responses are indicative of lying, which they're not valid really or reliable, because there have been sociopaths who could just lie through a lie detector test no problem. And then there are some people who just get so dang nervous you can't measure them accurately. Neurological and neuropsychological tests, these are just looking at brain imaging. So neurological tests is looking at the brain structure and activity, whereas neuropsychological tests are more looking at your cognitive, perceptual, and motor performances during tasks. So one is just kind of imaging, taking pictures using different methods, as you'll read in your text. And the other is doing that kind of process, but as someone's performing a task. So maybe I want to measure certain brain activity as you're participating in a video game. That's a neuropsychological measure. And then there's intelligence tests, which were used a lot back in the day, still kind of used because they're very helpful in identifying like children with disabilities. That's very important because it compares them to their peers. But they can be misused because some people use them as like a status marker, like, oh, look how intelligent I am, right? So sometimes they tend to be misused. But they have high reliability and high validity because they're measuring, how people go about certain tasks, like what cues they draw in on, what knowledge they are using, and what they are applying to figure out those tasks. And the limitations there really lie in the motivation. Some kids may be motivated to take the test and some might not be. And also cultural bias. There were issues with cultural bias previously because these tests were designed using experiences based on Western white educated people as opposed to people of different races, for example. They could still be educated, of course, but they may not identify with the experiences that would lend themselves to the knowledge needed to complete those tasks. For example, if I asked a question, y'all grew up in, if you grew up in Washington, you grew up in a boat town, right? So you know the answer. But where I'm from in Chicago, the only people who have boats are the super, super bougie rich people. So if you ask someone who has never had experience with a boat, so maybe of lower SES, steering wheel is to car as blank is to boat, right? They may not know the answer because they don't have experience with that cultural thing of owning a boat. So there's some issues there. But they've sought to rectify them over the years with culturally sensitive tests.